Very good evening, everybody. And I think we are meeting after quite some time. And thank you for joining in. If you're here, you can just write some in the live chat that you are here. And today we have a very special person with us, and I'll be taking you through the journey, very fascinating journey she has. But well, I'll not waste much time, and let me just tell you that who I have today. So I have Dr. Gaganjot Kaur. Currently, she is the professor and head of the Department of Oral Pathology, Shaheed Kartar Singh, Sarabha Dental College, Ludhiana, Punjab, India. Dr. Kaur is an academician, and she has been teaching more than a decade, more than 12 years, and she's still continuing her journey as an academician as well as a clinician. So you can pretty well understand that what plethora of achievements and associations she would be having in this entire journey of her academics. But I will definitely tell you one thing about her which actually catched my eye, and it is pretty interesting. That is, apart from her being a dental professional, or a specialist rather, I should say. Uh, Dr. Gaganjot is a certified nutritionist and dietitian. This is something which we really don't see this combination of academics. So I think she runs her dental practice in a way where she makes sure that this part of nutrition and diet is being focused, and her clinic she's the director of her diet. She calls it as diet clinic, which is pretty interesting, easy diet, where she actually, apart from her regular diet practices, she specializes in the dental considerations and dietary changes. So I will not waste much time, and let me just call in Dr. Gaganjot. Hello, Dr.
Hi.
Gaganjot. Thank you
Hi.
so much for joining in today. And I was just speaking about you to the audience, and that fascinating point, as I already told, that being a dental professional, an academician, as well as that one very important and not much spoken of attribute that you have, tagged as a feather with you as a certified nutritionist and dietitian. That's something which is very, very interesting. So I welcome you here today, and thank you for joining this show. So to all the audience, I would like to say one thing, that recently we organized the third International Saliva Summit of India online. So that's the annual conference that we do under through our academic banner of Indian Academy for Clinical and Dental Genetics. And today, Dr. Gaganjot is here for a purpose, to share her inspirational journey. And apart from that, from our entire team and our academy and our organization, we are really thankful to Dr. Gaganjot, as we proudly call her as the SALSI 21 ambassador, because she has
Thank
been
you.
instrumental in contributing all kind of support, and I think she has been very inspiring to all of us, and she has brought so many youngsters inside, and they got a very good insight out of this conference. That is how we have Dr. Gaganjot here today. So yeah, so Dr. Gaganjot, so let me just start shooting my questions to you, and I think
Yes,
it's
sure.
more more of a candid conversation that we would be liking to learn from you, actually, because through this conversation, I think the area that you have focused, which actually interests me very much, that how you have nicely related the most important part, that is dietetics and nutrition, along with dentistry. So I think we will talk more on it. So but before that, as a general question, as a dental professional, I would like to understand your views, that what how do you how do you feel about, or what are your views about the importance of dental awareness program in India? If you can just tell us your views.
Hello, Dr. Gagi. It is such a pleasure to see you again. And it gives me immense pleasure when I talk to you because you're such a vibrant person. And regarding the dental awareness, coming directly to the question, the dental awareness in India, to my dismay, this particular thing has always taken a back seat in India. Well, when we talk about the other countries, I think that Denmark has got the most aware public, as in when we talk about the dental awareness. But when it comes to India, it is always not. I regret to say that it is not as good as in the other countries. Well. Let's come to the solution, because the reasons are for this are like, 90% of the people, they do not refer the dentist for the dental advice. The statistics show that 88% of the people, they actually do not refer a dentist for their teeth. They can ask the advice to a chemist or a non-dentist person, but they do not turn up to the dentist for a advice which is actually our area of specialization.
Right.
The IDA has put so much emphasis on this, and has tried making so many attempts, and they have also started a project which is known as the Bargain Project, in which they have actually stressed upon the importance of dental awareness in India. They have put up especially they have put up in two fields, that is the tobacco intervention and the what you call the cancer awareness. But still, a lot of things have to be done when it comes to the dental awareness, because I think the rural population, they need to be addressed, and the pictorial displays that has to be initiated. Along with the pictorial display, there should always be a proper display of the the after effects when you don't when you go to the quacks, or when you go to the what do you call the chemist for the advice. So this thing should actually be addressed in a more professional way. Let me put like that. Otherwise, a lot of people, my sincere advice, see, we as dentists are putting a lot of efforts so that the people get aware about the certain techniques. But I think a lot has to be done in this field, especially in India.
I totally agree with your views, and so nicely you have put up. You have actually shown people the pathway about the small solutions which are quite easy and can be taken up. So, and I must thank some of our audience who have already joined us, and they are wishing us good evening. Thank you, Dr. Dinsha. Thank you, Stalin. Both of them are here. I mean, they have written in the chat. So, and thanks for joining with us. That's really inspiring. Okay, so I think. One tagline that goes with any woman is multitasker. So, and
Yeah.
yeah, so I really, this is a one common question whenever I interview any of my women colleague and friend like you. So I would like to know how you manage this multitasking, and what tips would you like to give to our young women, not young, I mean to any of our women colleague and friends, in dealing the house as well as the work, I mean profession and personal, and that's the balance has to be there. I think uh, we'd really like to know from you, because I know that the way you take things forward, you being a professor, I mean, you also have to handle academics, you have to handle administrative, you have to handle clinic, you have to handle as well your kids, I mean, your home. So I'd really like to know how you manage your work-life balance.
Well, we as women are, born to multitask. That's what I feel. The moment we are born, actually, the we are raised in the way to multitask. When we are born with the spirit. We are fighters. We never give up. So we, as a woman, we are just born for this thing for multitasking. Well, when we talk about the tips, I think it is inbuilt in every woman. But what I would like to suggest to most of the women out there is, just take things easy as they come. We stress about our kids, we stress about certain things, we do not pay attention to the health, which is actually of prime importance. And one more thing which I used to tell to every person, be it young or old, be it a young woman or an older one, I would just like to tell: work. Well, when we work, then the failure is a little scared from us, you know. So work and failure, they are just like water and oil, they just repel each other. So work is something, obviously everybody works, but to work and to let go certain situations is the key to have a good health. And actually, to that's a mantra for success, especially for women, because when we being as a woman, we have to take it, we usually think about others, we think about what the other person is going to think about this, what the other person is going to react. And you know that, it's not a it's not a world full of roses when it comes to workplace, or when it comes to any other thing, especially for the women. Now, I would just like to tell to all the women out there, just work and just let go. And that is, multitasking is inbuilt in you. It is already, there inside you. It is just that we have to work and we have to let go certain situations. That is the only advice. And yes, the health is of prime importance. If you are good, you are strong, and you are healthy, you will raise a strong and a healthy family.
I think that that's amazing. I mean, that's really very practical, and the very true words, or rather words of wisdom that you have shared, Dr. Gaganjot, with us. And I think I really am in tune with you, because I agree. I totally agree, because I think that's in the genetics of female
Yes.
DNA. That so yes, yes,
Yes.
and I think it's very very important point that I would also just like to tune in and just take your words and repeat again, that to let go, that is very important, because this is one thing
Yes.
which I think it's not about men and women, we all have to do that, but I think particularly women, we have to change in every phases of life. There is we keep changing, our life is not constant. So I think letting go things helps us to emerge in a more better way. And as you rightly mentioned, that that is very important for physical as well as mental health, which is very very important to carry on the tasks forward and keep the work
That's
life
right.
balance. Yeah.
Yes, of
So
course.
well, so Dr. Gaganjot, I would really like to understand that about the. I mean, when I read your profile, the first thing that caught my eye is about this: you being a certified dietitian and a nutritionist specialist. So, I would really like you to tell about this part of your journey of academics and how exactly you got into it, and what is your inspiration behind this, and how do it do this particular aspect of your attribute help you or give you more potential to take the day to day life tasks, both in your professional as well as personal life. So I'd really like to know about it.
Well, when we talk about my journey as a dietitian and as a nutritionist, it is way back in my childhood, actually. We have to go a little back, in my childhood. My mother, she was a very good cook and an excellent cook. And I being born in a Punjabi family, we, take everything for food. Like
Yeah,
if you are stressed up, have a cup of tea, it'll go off. If you have a headache, okay, you have a cup of tea, it'll go off. Okay. So my mother, she gave
I
a
think I
lot of
think
importance
that
to
that's
food.
the common connect. Sorry to interrupt. That's a common connection between Bengalis as well. So we
Yes.
start with something else, and the conversation will always end in food. Yeah.
Food, exactly, exactly.
Yes.
So my mom, she always used to give a lot of importance to food. And when I was sick, she never used to tell me to take medicine, but she was always the first person to ask ki beta kuch khaya, did you eat something, did you have something. So I was like, why so much of importance to food, mom? If always, whenever I used to ask her, she always used to tell me that, we work for food. We actually
Mm.
work for food. If there is no food on your plate, there is no sense of working. And she always
Right.
used to tell me how much ever stressed you are, you should always sit and eat. These are certain things I really
Mm.
remember as an adult also. So right from the beginning I had that thing in my mind that the food is of really really it's of vital importance. And as I grew older and I took up dentistry, and in the back of my mind somewhere it was there that I have to do something which will relate the food to the dentist,
Mm.
because the oral health is actually a mirror of your systemic health, and the systemic health is related indirectly or directly to the diet you are taking. So with that I thought that I would like to do, but as being in the medical field, it took me a lot of time and lot of energy to complete that particular thing. And later on I did do my a topic of my interest, that is I wanted to correlate food with general health and in turn with the oral health. Second thing that was that would interest me always was the increasing rate of obesity in Punjab, even be it the age group from as young as 10 to 12 years to as elderly as the 60 to 70 years. 90% of the population in Punjab is obese, and that is because of the changing habits. I don't know about the other states. See, I cannot comment about the other states, but whatever I see in Punjab, because our food is really rich and it is
Mm.
rich in, saturated, unsaturated
Yeah.
fats, lot of heart diseases, lot of strokes, lot of high BPs, lot of diabetes is found here.
Mm.
So,
Mm.
and whenever a patient walked into my clinic, the first thing I would ask for a dental patient also was to check his or her weight. And almost more than 80% of the people, they would have more than the desired weight. Along with, they would have BP, they would have diabetes. And
Mm.
it actually struck me really bad when a person who was as young as a child, who was as young as 10 to 12 years, entered into my clinic and weighed more than 90 kgs. So I was completely awestruck by the thing that this is a area which needs working. And actually, whenever we talk about weight, we talk about diet. And whenever we talk about diet, the first thing that comes into our mind is our teeth. So, this is how the chord struck, and this is how I started gaining interest in the dietetics. And then later on, I did put a wing in my dental clinic, which is known as an easy diet, in which I usually make people aware of what to eat, what not to eat, and also regarding the gum status, what food is good for the teeth, what food is good for the gums, how you can come down with the sensitivity by having these kinds of foods. All those I used to tell, along with an awareness programs, that I would like to take it on another level. That means I would like to propagate this particular area, and I would like to make the patients aware that diet is actually related to your dental health as well as related to your general health. So prevention is better than cure, they say, and I feel that this is an area which can be actually taken into consideration whenever there is going to be prevention. So prevention is always better, and a healthy diet is always better. After you know after you've taken your diet and you've taken a sugar rich diet and you have spoiled your teeth, then only thing that can occur is treatment. You cannot restore the teeth back, okay? But yes, as far as this is concerned, I would just like to tell them that prevention takes a first seat.
I think that's fantastically explained, and I really like the way you have taken this up because I personally, this is also my mindset where I talk about holistic approach to a particular, to a particular human health. It's not only about we being a dentist or after all, we are healthcare professionals, and as you
Yes.
rightly say that oral health actually is just the mirror. It gives us a sense about what's happening inside the system. So I think this is really fantastic, Dr. Gaganjot, and you're doing a great work, because you have come up with a formative structure of your thoughts and visions, and you have actually got yourself trained as a dietitian. Is not just reading from the internet few bits and pieces and just telling to people, right? So that's really really nice. And I think, as you said, taking this to the next level, yes, I think that is one thing which you must do it. And I think any support from our side, we'll be very happy to help you
By
out.
God's
uh,
grace, if we, by God's grace, if we collaborate this way, I think this is going to be a very revolutionary thing that is going to happen,
Absolutely. Absolutely.
because this is actually a newer concept, and people who are just foregoing this concept, they should be actually made aware of the certain things.
Yes, absolutely. I agree 100% with you. And I think we have some of your fans here, Dr. Shiva Kumar MS, who says great going. Dr. Srinivas Vanaki says, hi
They
Gagan, proud
are
of
actually
your
my
clinic.
teachers. I am indebted to them
Amazing,
actually. I am
amazing,
indebted to
amazing.
them actually. Whatever I am, it is all because of them. Dr. Banki,
And
he is one of the most idealistic teacher and whom I look upon for everything. And
so
as
nice.
I told you, as I told you, there are certain few people who are so important in my life, like Dr. Vanaki, Dr. Shiv Kumar, Dr. Beena, who's such a
Mhm.
good friend and a guide to me. And these are certain people whom I'll always be indebted to. I thank, and on this platform, if they are there and if they are listening to me, I will always be very, very thankful to them.
Yes, yes. So I think that I really I mean, yes, mentors are some those people who actually helps us to
Yes.
form our brings the best out of us, and we can actually go and step forward into the unpredictable or unknown world, only from the learnings that we get from their
Yes.
their insights. And actually we carry forward the things that we take from our mentors. So I think that's amazing. That's really so nice to see your mentors listening this show, and I'm also honored with their presence. Thank you so much for joining. So, I would like to now coming back to a very tricky question. Not tricky, but I'll just say that.
Yes.
Uh, that is one thing which is running in my mind. I think, Dr. Gaganjot, you have been one of the many of the participants who has joined in one of my course, that is oral cancer genetics. But I think
Yes.
you were one of the most enthusiastic participant. I must say, the way you would give those boosts of appreciation and that motivation. I think that was very fantastic. And but I would like to know that how your interest developed in the field of saliva, because I think as you have shared before also, this was something new area which actually catched your eye, and then you came inside and inside SALSI as well, and thereon you started the thing. So I would really like to know that how would I mean, what was your basic what actually interested you inside getting into more into saliva? Yeah.
Well, saliva is a miraculous fluid, and I, being a dentist, I was never new to saliva. But the thing was that I always, in general practice, when you do, you repel saliva because you tend to just isolate the teeth from the
Yes.
saliva so that you can have a good restoration. But I was an oral pathologist, and I wanted to pursue that as an oral pathologist. Saliva has a lot more role to play, and it is always underestimated. So, whenever I was talking about the precancerous lesions, I have also been taking certain lectures when we talk about certain guest lectures in all the other colleges as well as in the IDAs, with a stress on uh, how the general practitioners they can just give us certain biopsy samples in certain pre-malignant lesions and conditions. And this was my area of interest right from the beginning as an oral pathologist. And I always used to tell everybody, like whenever I used to go somewhere, they always used to ask me what an oral pathologist does. They only take classes, they don't. I said the area of oral pathology is so vast, and it is having so much to do that it is an underestimated thing. So, whenever I used to talk about the biopsy, people used to be a little reluctant because biopsy involves cutting of tissues, it involves incising the tissues, and it involves bleeding, it involves something which the patient used to be scared of, and even the dentist used to be scared of ki abhi itna chota sa white lesion hai and why to take a biopsy for that. They always used to tell me. So when at that time only I used to think there should be something which is very non-invasive. We had FNAC, of course, but again
Yeah.
there are so many faults with that also. There can be, there can be false positive results, false negative results with the FNACs. So what I thought was, why not saliva? Saliva is so easy to collect, it is having so much into it, it is having. And when you came up with the concept of saliva and oral cancer, I was like enlightened with this. I was like, I was so enthusiastic because I was learning something which actually was of interest to me. And when you came up with saliva as a diagnostic tool, I was jumping with joy because now I could do something which is very non invasive and which is very precise. And there are studies in SALSI, I came to know that there are studies that even more preciser than blood. you know
Yeah.
the oral lesions are there which can actually be diagnosed with the help of saliva. So this is what interests me, and thank you so much for bringing this concept here with me and with the dentist. I'm sure when I get to know more about saliva, I would be the first person to run behind you and tell you that, no, we need to do more research regarding this, we need to do more this thing, because this is a very fascinating field, and
Yes.
it is a very promising field actually.
Right. Right.
And
So
the thing is that it has always been overlooked. That's what I want to say, that the things which are overlooked, and moreover they have a ease of collection, why not take it into consideration? And all thanks to
absolutely.
you.
No, that's my real pleasure, and you are very kind, I must say. So, Dr. Gaganjot, I am pretty sure that you are an avid researcher, being an academician, and particularly being into the field of oral pathology. So, how would you like to motivate your students, both at the undergraduate or postgraduate level, towards the pathway of research? Because I think the term research and the things related to research is not very much correctly understood in our fraternity. I would be very straight on this. So that's my
Yes.
experience. I hope you also agree with in that point. So how would you?
Yes.
What are the, if you just give some tips, because I think many students would be listening this now or later when they see the recorded version as well. So I think that will really help them. Your insights will really help them. Yeah.
Well, when we talk about research, the first thing that comes to our mind is lot of armamentarium. You need big microscopes, you need a lot of complex things, you need the research work, they say, is never related to simple. I mean, they cannot correlate the two words. Simple and research are two words which are actually, they think that is opposite. But when we talk about saliva as a research fluid, we are so blessed to have an armamentarium where you can, it is at affordable prices. And second thing, the undergraduates have a plethoric access to this particular thing because they have a lot of patients. The undergraduates or the postgraduates, maybe, I mean, whoever wants to take up this, they have a plethoric access to all the patients, and they have a plethoric access to the pre-malignant lesions and conditions, the malignancies. Everything is coming to them, but the only thing they are lacking is lack of awareness. आया है, it is there, but how to take up, what to do, what else can we do, how to, plan it. You must be you must be remembering that in my earlier days, I used to ask you a lot of questions: how to plan my research, how to do this, how to do that. That is because I was always thinking that research needs a lot of complex armamentarium. It needs a lot of study. It needs a lot of this thing. Of course, the study part is still there, but uh, we can do a research in a limited armamentarium and in a limited access with saliva. And the only thing which we require is the access to the patients, which we already have. So, as undergraduates and postgraduates, I think they should be the first people to be enthusiastic with this research and should come up with in more numbers, so that this thing can be taken up at right from the undergraduation level to the faculty level.
Right. And I think many of your students who came inside SALSI conference have presented pretty well posters and papers.
Yes.
And that was really inspiring to see, because I think that might have been, for most of them, it might have been a very new thing, but they have made a very good
Yes.
try, I must say that. And coming to the concluding part of this conversation, Dr. Gaganjot, I would like to know that in one line, what message would you like to give on how would you or rather how would you like to express yourself as a dentist, an academician, clinician? You have so many things with so many feathers in your cap, a researcher, a dietitian, and as a woman. So yeah, I would really like to know, and our audience will get very inspired from your insights.
Well, summing up everything in one line is a little bit difficult because, as a woman, I think we have a habit of speaking, and and it becomes really difficult for me to sum up. But yes, if you ask me, there is only one answer to every question, and that is work. Work, and we are blessed souls. We are having access to beautiful people in the world, to beautiful families in our world. And the only thing that I would like to put into this thing is that, work, and I told you, work and failure, they usually don't mingle very well. So they repel each other. So, like water and oil. So let us put it in that way: work and let go. That is the only message which I would like to give to any person.
Thank you, Dr. Gaganjot. And I think all of who has joined us in the live, as well as who will be listening to this conversation later, will really get inspired through your thoughts and insight. And thank you for coming inside, and thank you for being a great help in our being very instrumental in supporting our conference. I'm really I'm really obliged, and thank you so much for joining this show and giving your time today. So I think with that, we will end this conversation. And I think I have to take up more conversations with you regarding your regarding the insight that you how you actually practice the dietetics and nutrition, and what are your future visions. Because I think one conversation is very less, because I think we have to keep more sessions with you in the future.
Thank you so much, Dr. Gagi. It was such a pleasure to meet you. You are such an enthusiastic researcher, a vibrant person, and a kind person, and a good person at heart. And I am really obliged to be associated with you. And I hope this association works and we do wonders. And good night, and have a very blessed day tomorrow. Thank you.
Thank you so much.